Mohammed Moin, and we're going to today discuss the B scan of the eye. And B scan is an ultrasound, what is called a brightness mode, and it works at 10 megahertz. You can see over here this probe is 12.5 megahertz, and the gain which is set, or the brightness which is set, as 95 decibel with a zoom of 1. And what you're seeing over here in this scan is this is the surface of the retina which you see, and this patient, it seems to be slightly oval compared to what you would see in a circular posterior curvature of the eyeball. And these type of patients with the longer and oval type of appearance would represent patients with high myopia. So this is the case. What you have is a B scan. You've got a transducer or a probe which emits sound waves, and these round waves travel all the way through the different media, which include the cornea, the lens, the vitreous, and they're reflected back from the surface of the retina. And then the lights, when they come back, they are picked up by a transducer and they are analyzed. The distance it travels, any slowing down of the sound waves during that distance travel is calculated, and this gives you this picture in a B scan. What you see at the back over here is the optic disc in the center, and this scan in which you see the optic disc is called the axial scan. And in this scan, what you want to see on the side is these whitish or hyper reflective area. This is orbital fat. So if you join the A scan along with this, so A scan would have high peaks over here in the lens, and then there are high peaks over the retina, but they slowly come down and they become flatter as they go through the orbital fat. So the view can be both of the retina, or you can take an orbital view on a B scan. So let's move forward and see what you see in this video, in this patient, in which there's one patient we're showing you. So the B scan is of two types. One is dynamic and one is static. So it's very important, especially in cases of retinal detachment or any vitreous pathology, to see a dynamic scan. So you can see dynamic means you ask the patient to look down, look up, or look to the sides, and then you see what is the movement of different structures. What is the movement of the vitreous? What is the movement of the retina? And any other structures which are moving along with this. So in this patient, you can see there is definitely the detachment of the retina. So there's a V-shaped appearance of the retina. So if you had an A scan along with it over here, you would have 100% reflectivity over here, and that would represent the retina in these cases. The important thing is, if this whitish appearance or hyperreflective line is attached to the optic disc, that means that this is a retinal detachment. While if this line was not attached to the optic disc, then it would be a posterior vitreous detachment. And if it is attaching somewhere else and the configuration is more of a concave appearance, then it would be a patient having a tractional retinal detachment. If we move this forward, what we'll see is this moves when you move the eye, but the movement is not very brisk or not very 100% mobility. So this is a retinal detachment because it tends to get restricted when you go into that movement, compared to if this was a PVD. Then in that kind of a case, what you would see is more of patient having more fluent movement. The undulations will be much more. And the other thing which is important, this is the undulating appearance of the retina. And sometimes if there is a chronic retinal detachment, you might see a cyst on the surface of the retina on a B scan. That would tell you this is a chronic retinal detachment rather than a fresh retinal detachment. And the mobility would be more in a fresh retinal detachment and compared to a chronic retinal detachment. So in conclusion, B-scan is an invaluable tool, and it is used in patients with opaque media, or even in patients with clear media if there is any doubt of a problem in the vitreous or the retina. Thank you very much for watching. Please subscribe to the channel and click the like button. Thank you.